My name is Amanda Burgus. I am the Director of Acute Care Units, Float Pool, and Care Continuum, which is case management social work for Great River Health System. I have been here for 17 years. A strong Med-Surg telemetry background kind of sets the precedence for your skill set in growing and putting the puzzle pieces together and understanding what's going on with the patient. It helps you gain your clinical perspective, your clinical skill set, critical thinking skills, how to prioritize the care of your patients. Telemetry ratio is a 1-to-4 and a Med-Surg is a 1-to-5. You learn different sets of diagnoses, disease processes, your basic assessment skills. In order to set the right path for your career and your skills, you do at least a year on a telemetry Med-Surg unit. I started out at the Fort Madison campus as a Med-Surg nurse. I did that for 3 years. I also floated to what we called our special care unit, as well as our day surgery, even to OB, ED, and I just floated all over and soaked up as much knowledge as I could. Going into nursing school, I wanted to be an OR nurse. And after starting nursing school and doing clinical rotations through the OR, I realized that was not for me. And I knew that I enjoyed critical care and cardiac, and I developed a passion for process improvement while growing into these different areas. So I moved into case management, and I learned the utilization side of insurances and the quality care of the patient, and then eventually moving up into leadership. And at that time I was trying to determine, do I want to be a nurse practitioner or do I want to stick in the path of growing up into leadership? Great River Health has always been very family oriented. They looked at me as a person, and I never really felt like a number, where you may feel that at larger facilities. And they supported me in trying to determine what I wanted to do as a nurse, because nursing, you can go into so many different areas. I've always felt like I've had that support in trying to manage my work-life balance and with school. I was very successful in doing that while raising a family and having a husband in the Army. I really encourage new grads to get that basic experience on a telemetry Med-Surg unit to help you with your delegation skills, your prioritization skills, gain your clinical skill set of your basic assessment, what's normal, what's abnormal, and then grow into a critical setting. And you can kind of identify based on how you're interacting with the patients and others in the care continuum of what areas you may be interested in after you have worked in the health system or in that career path for a short time.